Probably just 1 or 2 more minutes. We've got folks calling in, and we'll get started very shortly. Okay, I think we'll get started. My name is Bill Gallo. I'm with the Office for State, Tribal, Local, and Territorial Support, Partnership Support Unit. I'm the Associate Director for Insular Area Support. I work out of Honolulu, Hawaii, and I work, much of my job is working with the U.S. affiliated Pacific Islands, and a key partner for CDC as far as being able to get our work done in the Pacific is the Pacific Island Health Officers Association. And we're very fortunate today here to have 5 members of their staff. Amy Chutaro, their executive director, is here with 3 of their technical staff and their chief financial officer. So I think without further ado, I will let Amy begin, and she will introduce the rest of her staff as well. So thank you very much.
My apologies, I am significantly shorter than Bill. Oh, wow, this is fancy. I never saw a podium that went up and down. Oh, that's cool. Small wonders. Thank you very much, Bill, for the introduction, and thank you to every single one of you who's taken time out of your busy schedules to listen to the series of presentations by myself and others of the Pacific Island Health Officers staff. So thank you very much for listening in to some of the work that we're doing in the Pacific. Just very quick round of introductions. You know, I'm Amy Chutaro. I'm the Executive Director for the Pacific Island Health Officers Association, or PIHOA for short, so we'll be using that acronym quite a lot. In addition, I'm just going to do some left to right very quickly. Dr. Andre Mark Duran, who is our Regional Health Information Management Systems and Performance Management Coordinator. Dr. Vasiti Uluiviti, our Regional Lab Strengthening Coordinator. And at the very end there, but last but not least, Dr. Angela Tejero Pedro, who's our primary care, Pacific Basin Primary Care Office Coordinator. Each of them will be providing a presentation specific to their area of work, but what I will be presenting on is more sort of the context of the Pacific, our regional mandates, and I will sort of very briefly touch upon some of the activities and then hand it over to the rest of the panelists to be able to give a little bit more detailed information. So, first of all, my apologies to those of you who've seen this presentation last year, because I presented something very similar last year to give some idea of the work that we're doing in the Pacific and our geographic location. So it's the same map that I think I showed last year. But for those of you who haven't seen this, this shows essentially the geographic scale of the area that we work in. So Hawaii is where our headquarters is located, but in terms of the jurisdictions that we work with, American Samoa here down in the south, Marshall Islands where I'm from, Federated States of Micronesia, which pretty much spans all these islands here, Palau, Republic of Palau, Guam, and the Commonwealth of the Northern Mariana Islands. So this spans essentially 5 time zones that we operate in, and both above and below the equator. And if we were to superimpose the continental United States on this map, American Samoa is just beyond, a little bit beyond the tip of Florida, and then the CNMI just about hits past Washington State. So it's a very large, extensive area that we have to operate in. And in addition to that, we also work a lot with our respective partners that are located, some of them are here in Australia, some are located in the Philippines. The WHO regional office is based here in the Philippines. And then we have a number of sub-regional UN, United Nations offices, and the WIPRO Pacific office, WHO Pacific office is here in Fiji. So we actually have interactions not only in the Northern Pacific with the U.S. affiliate Pacific Islands, but also with our Southern Pacific partners in the region. In addition to, of course, those in Hawaii, and then down this way, we're in the continental United States. We are very diverse people. I think there's sometimes a tendency to see the Pacific as sort of homogeneous, very similar cultural practices, in which, to some degree, yes, that is true. There is sort of a core base of where we share a lot of commonalities, but there's also a lot of very diverse and critical differences, amongst our population. So on the one hand, we have very highly urbanized environments, and then on the opposite extreme, we have very, very rural populations that still live traditional lifestyle that they've lived, for the last, few hundred years. So just to give you an example, this is in Yap FSM. They still wear traditional clothes. They do not support any Western practices and clothing and things like that. So when we go in, we do site visits, or we do travel to these outer islands, we have to wear traditional clothes because they don't allow Western garb in those islands. And then we have everything in between. Here is the Saipan, one of the more urban settings, Guam, which has much more of a sort of American feel to these islands. And then here, where I'm from, here in the Marshall Islands, still very much traditional lifestyle out in the rural outer islands, American Samoa, and Federated States of Micronesia. And I'm sorry, I forgot to mention also in terms of languages. So we don't speak the same language. Each island has its own unique language. So roughly about 12 distinct separate languages. And then within that, multiple dialects in those language groups. So even though English is sort of the common language of government, there's also the individual languages that are specific to each jurisdiction. And sometimes there's different languages spoken from the main population center to the outer island rural center areas. They don't often speak the same language. So that poses some language challenges in terms of how we ensure that the language of public health interventions is appropriate and relevant to those specific contexts. Diverse environments. So I think a lot of folks tend to see island environments as very, very similar, but in truth, there's a lot of diversity even within island environments. So we have what we call your high volcanic islands that have mountains, lush vegetation. We'll often have river systems or waterfalls and things of that nature, which is more like what we see, here, in Pohnpei, Federated States of Micronesia, to some extent in Guam. Well, Guam doesn't have any mountains, to be honest. They have plateaus. But the ones that have mountains are actually Pohnpei, Federated States of Micronesia, and Kosrae. Then we have sort of what I call the in-between islands, where they are high islands, but they don't necessarily have any mountains. So Guam is sort of one of those. Yap is another one, and to some extent, Palau sort of fits in sort of in between. And then where I'm from are what we call the low-lying atolls, which don't have mountains. Water. Potable water has to be gathered through water catchment systems to catch the rain for water. So that poses a lot of challenges in terms of being able to meet the needs of very crowded urban settings where you need to be able to distribute good quality water to the population. And of course, because of some of the overcrowding that we're seeing in some of the islands, there's a lot of public health challenges that you can see. So here is an example of a typical home in the Marshall Islands where, and I don't know if you can see this very well, but there's a little outcropping here. That's the family toilet, right? So it doesn't go into any sewer; it just goes straight into the lagoon. And of course, everybody's swimming, fishing, etc. in the lagoon. And because of our island environments, there's a range of vulnerabilities. It's not unique to the Pacific, but because of where we're at in relation to the rest of the Pacific, the Central Pacific, more recent times, because of climate change, heating up of the ocean systems, our islands have seen much more frequent natural events, especially in the last few years. We've had a lot of typhoons and hurricanes. Well, we call them typhoons, but hurricanes in our region that have been very devastating to a lot of the islands. And because of the existing infrastructure already being very weak, the damage that is caused, it can be very extensive for most of our islands. Other vulnerabilities, overpopulation, overcrowding in very, very limited space. So land is an extreme premium in our island environments because it's not like you can spread out to the suburbs and the burbs beyond that. And then we have a very, very definitive line of embarkation between where you can actually put residences to then when you're in the ocean. And then what we're seeing now in some of the more larger islands in the USPIs is economic development that is in many ways is very positive. It's tourism development, it's fisheries and whatnot. But that has also then brought on its own challenges in terms of whether the health infrastructure is sufficient and robust to be able to address this growing population of tourists coming through, the potential health impacts of that, and of course some of the subsidiary industries that help that sometimes crop up as a result of that. So for example, things like issues around human trafficking, where they're bringing in men and women, from mainland China, Philippines, to be hostesses and hosts at these massage parlors, which sort of are fronts for brothels and things of that nature. So there's a lot of sort of ancillary subsidiary services that sort of crop up as part of the expanding tourism industry. And in some of our islands, historically in the 50s and the 60s, our islands were used as nuclear testing sites for the United States. So we have some islands where some of the populations have the highest incidences of certain types of cancers. So that has created a very significant burden for the health systems to be able to meet the needs of those very specific special populations that require very extensive, specialized health services. And then I want to talk a little bit about climate change because I think despite despite the current administration's perspective on this and no longer supporting the Paris Declaration, I do really need to state that climate change is very real for us in the Pacific. Particularly when we're talking about warming waters. So warm waters, they expand, sea level rise as a result of that expansion, thermal expansion, but in addition to the thawing of the ice in the North Pole, when you add those two factors together, we have significant sea level rise throughout all of our island communities. So just to give you some view to that, we have areas really that are now in constant inundation when we have a normal tide event. Here is a road on one of the atolls. So every time there's a little bit of wave action, the sea level is pretty much on par with the level of the land. So there's not much barrier to stop any of the waves to come over. And here just to kind of give you some perspective, this is where my elementary school is at. So here's the graves, and to the back part of it was my elementary school. This is a normal tide event that we're seeing. So for some who are talking about climate change not being a real thing, or it's not a scientific reality, or et cetera, I really, really need to say I beg to differ, because for us, that is just not the reality of our environment. So when we're talking about public health response, I think the consideration of climate change and compounding some of those challenges, I think is really important to consider when you're operating in the Pacific. And this is just an example of a home that used to be, well, it still is, along the shore. So the ocean is actually right here. The beach and the shore is right here. So the erosion of the topsoil, basically just, the soil just kind of got swept out from underneath the foundation of the house, and eventually the foundation of the house just collapsed. So this family is living under half an house at this stage. And then, as I was mentioning earlier, hurricanes. So again, going back to the change in climate, what we've seen is more El Nino events, which means warmer waters. Because of warmer waters, then the frequency of storms occurring in our area. So this is an example here of a family. This is in Saipan. After Typhoon Sotalor hit Saipan, a number of the folks there had to set up makeshift tents and with whatever materials that they could find in order to be able to continue to live on the island. Other vulnerabilities, I think, are really important to stress, and when we're talking particularly around the issue of global health security, pandemic preparedness, sort of all those buzzwords, it's really important to understand one thing. We straddle that corridor between the continental United States and the East Asian countries. So we're talking about Cambodia, Malaysia, Indonesia, mainland China, Korea, Taiwan, Japan, and all of us know that, in a lot of these in the East Asia corridor, we're talking about the H1N1, we're talking about SARS, we're talking about MERS-CoV. I mean, these are sort of pandemic hotspots, right? Well, we're right there next to them. And we're also right there next to the United States, the continental United States. What we're seeing in the Pacific has been a very strong and stronger, growing, expanding economic engagement with the East Asian corridor countries into the Pacific corridor. So the fishing industry is one of those examples where the Pacific is one of the last few tuna stocks. So the Atlantic stock has pretty much been fished out. So, and everybody loves their tuna. So they're all coming now to the Pacific to fish our waters. Now, these are not just legal fishing companies. These are also illegal fishing companies. And most of these fishing vessels, where are they from? They're from mainland China. They're from Indonesia. They're from Malaysia, Korea, Japan, Russia, India, and I believe there's one more country I'm missing here. Vietnam. So there's all these, this very highly mobile seafaring population that is cycling through our islands, and they're on shore leave, and they'll sometimes come, be on shore leave for fairly extended periods of time, especially during times of the season when the weather is not very productive for fishing. So they'll stay, let's say, in Madro Lagoon at any given time, and they'll be there for a good 2 weeks, 3 weeks, sometimes more. And of course, the services that crop up as a result to serve the seafaring population, we also have that in addition to that. So when people are talking about pandemics, they often say, well, airports, let's do ports of entry screening at the airports. For us, it's not just the airports, it's also ports of entry screening at the seaports, because we have a huge mobility of seafarers that come through our seaports from the East Asian corridor. When you then look to say, okay, what is the health system? Is the health system able to do that kind of public health screening and monitoring, to look at risk and be able to respond to risk? This is an example. This is the emergency room in Krisrai. This is so that the Kashrai State Hospital, this is a public hospital, the only hospital, this is the ER in that hospital. Chuuk Hospital is very similar. Marshall Islands Hospital has gotten a little bit better than this, but this is basically what you see in the islands in terms of available healthcare services. Guam and CNMI are much better off. American Samoa also much better off. So here you have the hospital here, the only public hospital in Guam. But what I wanted to highlight here is that this hospital is I think it was built in the 1940s. There has not been any renovations to this hospital since then. So what's happening now is there's sections of this building that are now condemned and need to be completely razed and rebuilt. And here is a hospital in one of the islands. This is how they manage their biosafety waste out of both the public health and the hospital. So what I wanted to highlight here is that there's a lot of risks that are involved because of our very weak health systems. And you've got this East Asia corridor issue. And in addition to that, we have free mobility into the United States, into Hawaii, California, etc. But there's really no health screening to the extent that needs to happen in our islands. One of the key messages I really wanted to highlight to the CDC leadership is that we cannot be ignored as a potential public health risk for the United States. Some of you may know of the recent outbreaks of TB in Arkansas, Oklahoma. Some of you may know of the recent mumps outbreaks also in those states and other states. Some of you may have been involved in some of the Hansen's disease outbreaks that have also occurred sporadically in some of the islands, in the continental United States. And of course, the one Zika case in Hawaii. Those were all cases, index cases came from our islands. So it's very real. The fact that our health systems are weak is not just a burden and a problem for us in the islands, it is truly a problem also for the United States as well. So it's often very easy to say, small populations, they're insular areas, they're sort of way out there, a little bit out of sight, out of mind. But in reality, the impact is happening here and now, here in Oklahoma, in Arkansas, in California, in Washington State, in Oregon, Utah. So it's so critical that I think that link to the Pacific in terms of any public health response, both here domestically and in the insular areas, the two need to be looked at in equal measure, and not at the expense of the other. And just sort of last but not least, in terms of some of the pictorial view, this is the airport, the only airport in the Marshall Islands. You can see how pretty much it's at level with the ocean, so it's not unusual to be flying in, and if it's high tide, some of the salt water kind of lapping in on the sides as you're landing. So again, when we're talking about emergency response, what happens when there's a medical evacuation that has to happen in the middle of a storm? There is no other option. And most of our island communities are scattered in these little teeny weeny islands, across the board. So, Federated States of Micronesia, Marshall Islands, some of the outer islands of Palau are very much like this. So these are population groups that need to be served, but the question is how comprehensively and to what quality can we be able to provide services to such very isolated islands. Here is an example of an immunization run to one of the islands. So you have the main government ship here, but the ship cannot go into the lagoon because of the reef system. So they have to stay out in the open ocean, and then they have to ferry back and forth on these little speedboats to be able to take stuff out into the lagoon islands. And so when we're talking about cold chain management, when we're talking about distribution and procurement and sort of sending that out to different locations, it's a logistical nightmare, to say the least. Now, this is not to say that places like Alaska or other locations in the United States do not have similar logistical concerns. Everybody has, to some degree, a level of logistics concerns because of geography. But I think an island environment, ocean environment, does pose some very significant logistical challenges. So to kind of wrap that part of the presentation up, ultimately, looking at what we're seeing in our islands, our island communities, what is the value system that PIHOA brings into this work? As the Pacific Island Health Officers Association, what is our core values and principles in targeting and addressing some of these critical challenges in the region? So we support what we call the Healthy Islands vision, and this is a vision that was developed by the leadership of the entire Pacific region, not just the Northern Pacific, U.S. affiliated Pacific Islands, but the entire Pacific region, all adhere to this one vision, and that is that children are nurtured in body and mind, that environments invite learning and leisure, people work and age with dignity, there's ecological balance, and it is a source of pride. The ocean that protects us is sustained. So it really takes a very holistic view to how we address, how we define a healthy island community. So very quickly, who are we? We were established in 1986 by the health officials of the U.S. affiliated Pacific Islands of American Samoa, Sinai, Guam, FSM, and Palau. So our main governing structure, the executive and associate level of our governance structure are the chief, so the directors, secretaries of health, ministers of health of the islands, their deputy directors, and then directors of public health departments, and also CEOs of the local public hospitals comprise our executive and associate governing structure. And then our affiliate members are the regional professional associations. So we have a number of professional associations that are cross-cutting in discipline areas. So we have the Northern Pacific Environmental Health Association, we have the Pacific Basin Medical Association, we have the Pacific Basin Dental Association, American Pacific Nursing Leaders Council. There's 13 of them that are part of our association. So that provides a unique opportunity not only to do work ourselves in terms of providing direct TA, but also to partner up with existing associations that are existing in our region. Our headquarters is in Hawaii, but we also have a field office in Guam, and a project or mini field office in Palau, and then we have multiple staff that are deployed out to the various health departments in the region. We are the Regional Health Committee. We are the Secretary of the Regional Health Committee of the Micronesian Islands Forum. This is a forum of the presidents and governors of the U.S. affiliated Pacific Islands. So we are sort of an advisory committee to that forum, as well as a technical advisor to the Association of Pacific Island Legislators. So this is really critical when we're talking about policy level response to health issues. We're able to provide that input to this very critical group of people in the islands. In addition, very recently we've been very fortunate to be invited to be a member of the subcommittee of the CDC Stilts Committee, the State, Tribal, Local, and Territorial Subcommittee, which is a subcommittee of the Advisory Committee of the CDC directors, a lot of committees, excuse me. And very recently as well, last year and the year before, we were endorsed as the technical partner to the World Health Organization and to the Pacific Community in the wider Pacific region. So Pacific Community is a UN affiliate agency, a development agency that operates specifically in the Pacific. And of course, last but not least, and Mark will talk a little bit more about this, we're part of a number of networks in the wider Pacific region that looks at non-communicable disease surveillance and also communicable disease, those infections that are of outbreak, pandemic, potential network of public health surveillance folks across the Pacific region. So I think I talked a little bit about this one already, but in terms of our staffing, we have 10 FTE staff and about 56 subject matter experts, consultants that we have sort of on an ongoing retainer basis. working throughout our islands, and we're very lucky to host. I think there was 4 here, but did I put that? Yeah. So there's 4 of them. So 2 regional CDC immunization public health advisors. So we co-host them at our Guam office. 1 regional chronic disease epidemiologist from the chronic NCCDPHP, and 1 CDC regional career epidemiology field officer, CFO, from the Office of Public Health Preparedness and Response from CDC. So ultimately, our overarching goal is about health system strengthening. So my background is actually in development, so in the policy and planning in developing countries. So my background is development studies, working in very challenged environments that require a foundational approach to system strengthening and capacity building. So where we're focusing our efforts at the moment are in a number of cross-cutting areas. So we are looking to strengthen ancillary and other support services. So Vasiti will talk a little bit more about that from the lab side, the laboratory. Dr. Duran will be talking more on the health information management systems, strengthening the work that we're doing. In addition to that, the performance management and quality improvement work. Angie will talk a little bit, touch upon the human resource workforce development work that we're doing, both formal and non-formal workforce development that we're working on in terms of coordinating with the local community colleges, the regional academic institutions to provide accredited training on the one hand, but also more informal trainings that we provide on an ongoing basis. And where I sort of fit in is more sort of on the strategic engagement, working with CDC, across the HHS with HRSA, FDA, ASPR, others that are also engaged in work in the Pacific. I tried to coordinate across with those programs and agencies, as well as supporting our leadership to develop regional policy that can be best realized if all of us work together collectively as opposed to individual jurisdictions. And advocacy, obviously, in terms of sharing to the world what those challenges are, but also what our accomplishments are. And I think our region provides some very unique opportunities to explore some different innovations and approach, just because our populations are quite different. And there's ways to maybe look at us as a potential lab for some innovative technologies. Let's say, as an example, rapid testing technologies for very small populations, test that out. I think our populations, because they're very delineated, provide some unique opportunities for that type of innovative research and research. So I'm not going to belabor this too much because Vasiti will talk about this. But what I wanted to highlight here is that lab capacity in our islands is extremely limited. So when we're talking about infectious diseases, most of our diagnostic testing is not able to do that. So we have to refer our samples from both the public health and the hospitals to a reference laboratory outside. So we have to send it to Hawaii, to CDC Fort Collins in Colorado, sometimes to the CDC lab in Puerto Rico, and every once in a while we'll send them to the WHO certified labs in Australia and New Caledonia. So we have no choice but to send out some of these samples out to these islands, out to these other locations, both at great cost, but also at the cost of timely results, getting timely results. And so, of course, when we're talking about patient management or response that requires immediate information and data to be available on hand, that's not necessarily the case for us in our islands. Now, saying that, things are improving. Putting things online, web-based, hopefully that'll help to alleviate some of these timeliness of data availability. But the shipping is still an issue in the sense that it's still very expensive. So to send a box of biological samples from American Samoa to Hawaii State Lab, one-way trip costs roughly between $500, one trip. There's only 2 flights a week, so they only have 1 flight a week that they actually can send samples. So all the samples are accumulated over the week for the hospital and the public health and sent out in this cooler that gets sent up to Hawaii State Lab. Now, if there's mistakes in terms of the collection of those samples, if they were mislabeled somehow or something happens, the whole thing gets shipped back. the samples are rejected, and you have to redo it all over again. So here we go again. So I think, I just wanted to highlight that particular challenge. And so where PIHOA comes in is we've been able to provide some regional solutions to these challenges, and Facility will talk about that a little bit more. Again, with health information management systems, I'm not going to belabor this too much, but you have a list here, and I think you all have access to this PowerPoint presentation. But one of the critical areas of work is to strengthen EPI and surveillance capacity in the region. This is so important because, when we're talking about, okay, how many epidemiologists are there in the Pacific? Well, let's see. There's one in American Samoa, 1/2 in Guam. He's retired, so he gets pulled in whenever they need him. And how many in Palau? 1. That's it. Marshall Islands, no epidemiologist. Federated States of Micronesia, no epidemiologist. Right? So it becomes very critical for us, when we're talking about reporting, when we're the available data for informing public health response and public health programming. The data becomes a very, very critical challenge that is not readily available. So we need to build the capacity for epidemiology and surveillance in the region. And this is something that we've been focusing on for the last 5 years, especially to strengthen this capacity. So Mark will talk about that in more detail. Workforce development. Again, Angie will speak to this, but as I was mentioning earlier, we're not just in the public health realm, we're also in the clinical realm as well. So we have a number of programs that look at developing the public health workforce through accredited community college level, associates, certificate degree level type programs that we're working through with the Palau Community College, College of Micronesia, College of the Marshall Islands. But we're also now working in collaboration with the Fiji National University to build up more advanced clinical skills. So in the Marshall Islands, we have the nurse practitioner training program that we're running there. So the Marshall Islands does not have any nurse practitioners currently. So we have physicians, and then we have your LPNs and RNs, and nothing in between. So it was really critical, when we're talking about particularly services to the outer islands, to have more of an advanced clinical expertise that was just non-existent in the Marshall Islands. So it was really critical for us to then coordinate with somebody in the region that could provide that training for a degreed certified nurse practitioner training for the Marshall Islands. So we hope to be able to replicate this across some of the other island jurisdictions. Now, I sort of touched on this earlier about our populations in terms of education, and by and large, a good proportion of our core public health and staff have a high school degree or less. So when we're talking about very specialized services and we're talking about more advanced interventions that require sort of specialist understanding, we really don't have that cohort of people that can be able to engage to that level. So, but at the same time, what we were seeing is when we were encouraging a lot of our workforce to go and seek advanced training, they weren't surviving those trainings. We have a very high attrition in more advanced public health clinical training programs because they don't have the robust academic skills to be able to survive the academic rigors of some of these programs. So we had to retrench and rethink, okay, how are we going to do this? How are we going to address this issue of having a good local workforce that has the skills and the know-how to be able to do the work that they need to do? And it was very, very obvious that we needed to go beyond just the existing health workforce. We had to go to the high schools. So we went down to the high schools, and now we've got this program with one of the community colleges to work with graduating high school seniors and put them through a very intensive science, technology, STEM, basically, process, getting the math and their sciences skills up to par so that when they want to go into these health career tracks, they can survive them academically. So it becomes very critical for us to look even beyond not just at the tertiary level, but also the secondary, and hopefully at some point we can start going down to the primary level. So the education system is an area that we need to work a lot more with to address this issue. So I think this is one of my last slides, second to last slide. For some of you who have a particular interest in this, you know that we've had multiple Zika outbreaks globally, Brazil, Florida, Puerto Rico. In the Pacific, we had 3 jurisdictions that were impacted by Zika. So Koshrai in the Federated States of Micronesia, Marshall Islands, Madro in the Marshall Islands, and American Samoa. So we were given some funding from OPHPR, CDC OPHPR, to do Zika surge response in these islands. And I wanted to sort of highlight, what it took for us to be able to do this because of the lack of capacity in most instances in certain key subject matter expertise areas, as well as some weaknesses in the health systems to deliver services. We ended up using the funds to recruit 32 field SME consultants in these various areas, because these competencies and these skill sets were either non-existent or existent at a very, 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 very minimal level, and we needed to expand that expertise in order to be able to do a comprehensive quality Zika surge response in the islands. So to look at one of the other issues, and I didn't quite mention this too much in my earlier slides, but waste management is a very big problem in our islands because it's not like we have a lot of landfill areas that we can put our waste, and so it tends to accumulate in certain parts. And so when we're talking about mosquito vector-borne infections, these were primary breeding sites for particularly the Aedes aegypti that can breed in very, very small amounts of water in a relatively short period of time. So we have these examples of what we call the mountains of tires that we have scattered throughout some of the islands, primary breeding sites for mosquitoes. So it's not a surprise that not only did we have a Zika outbreak in some of our islands, but prior to that we had chick outbreaks, we've had dengue outbreaks, multiple dengue outbreaks, multiple chikungunya outbreaks, and in Koshrai we had a dual outbreak of both Zika and dengue. And now in American Samoa we have another resurgence of dengue, a different serotype. So for us in this tropical environment, it's inevitable to some extent, but we really need to be able to see how we can control that in a much more comprehensive way so that we don't have these continuous repeated outbreaks of arboviral infections throughout the islands. And speaking a little bit to health policy, we have a lot of mechanisms that we're looking at because each of the jurisdictions are very small. Koshrai has a population of now 7,000. Palau has a population of 20,000. Individually, there's really not a lot of political clout individually. So where it becomes important to pool our political resources together, our health resources together, is really to start acting collectively. So we have a lot of interventions that we've looked at that is supported through what we call regional health policy mechanisms. And there's a couple of examples of that I know Vasiti is going to touch upon in terms of lab. So she'll talk about that. So last but not least, looking forward for the next 5 years, there's still a lot of work that we have to do in terms of building our health system's resiliency. We have a lot of vulnerabilities that are outside of our immediate control, but we need to be able to address those vulnerabilities in a more comprehensive, strategic way, not only to protect us and our communities in our islands, but also to protect the continental United States. It's really critical that there's that interlinkage of response support from both perspectives. And, when we're talking about funding, so a lot of folks here may be project officers or maybe program coordinators that are funding various grantees in the Pacific. I think it's really important for me to sort of end with a note that though there's a lot of appreciation for this funding and it's really critically important for the islands that have very limited economies, economic development and economies, the funding is absolutely critical. But the question is that funding designed appropriately to meet our context-specific issues and challenges? That's a question that sometimes I have to ask all of our federal funding agencies, not just CDC, but HRSA, SAMHSA, FDA, et cetera, that are engaging in the Pacific. Is there a way to talk about whether funding mechanisms from the federal government, can they be designed, or is there flexibility in how they can be designed and administered for the Pacific? And it's not just the Pacific. I mean, my sense is that Virgin Islands has similar issues. To some extent, even Puerto Rico has similar issues. So the insular areas, I think, together, all of us have similar sort of concerns in terms of how federal funding is allocated to our respective islands. So thank you very much, everyone. I really appreciate your time. I tend to have that voice that puts people to sleep. So if you have any questions, feel free to ask after these presentations. I do want to hand over to Mark to go on to the next one. Oh, I'm sorry, Vasiti.